Hi, good morning. I am Dr. Jennifer Swoyer, and I am the program director here at Lagrange Family Medicine Residency Program in Lagrange, Illinois. I'm going to take a few minutes just to tell you a little bit about our history and some of the things that I think make us a wonderful place to do your residency. Lagrange as a residency program, was established in 1977. We have graduated 43 classes of residents, and a large majority of our graduates stay within our community. Our residency program is founded on being a community-based program. We sit in suburban Chicago. We consider ourselves urban suburban, as the service area that we focus on is right on the edge of the city. Our population has a lot of need and is very diverse. We have a lot of opportunities to continue to extend our mission and to provide opportunities for our residents and our physicians to provide community outreach. Some of the areas that we are most excited about are the opportunities that we have with our local homeless shelter and homeless community. We attend shelter twice a month. We provide an outpatient clinic for those patients that cares for ongoing and acute care needs as we try to help the system facilitate getting those patients housed permanently. We also work with a locally federally qualified health center where we provide all of their women's health and gynecologic services. The residents have a tremendous opportunity to have experience in women's health. They learn colposcopy, endometrial biopsy, other gynecologic procedures such as contraceptive management and prenatal care. We do a lot of other opportunities in the community. We work with the food pantries. We also have identified the need for a hygiene pantry and have a hygiene pantry that services our community and patients within the hospital who have been identified as not being able to successfully acquire the resources that they need to keep their homes and their persons clean and safe, especially during this pandemic. Lagrange is a great place to work. We are a 777 residency program, and when you come here as a resident, all experiences are yours. We are the only residency in the hospital, and our residents are treated with tremendous respect and are regularly engaged by all of the specialists within the hospital. It is a unique community. It's a wonderful place to work, and we look forward to having the opportunity to have you think about joining us.
Hi, my name is Dr. Alap. Shah. I'm the Associate Program Director here at Lagrange. And quickly, I'll talk about two of my interests. Dr. Lane Phillips and I are Suboxone prescribers, so we have a couple of patients that we prescribe to, and we're looking to kind of improve that. It's a recent thing that we took on about a year or two ago, and we're looking to expand that. I also run our simulation lab, where the residents get to basically practice hands-on with nursing and respiratory therapists in the hospital, real situations with cardiac arrests and rapid responses, cardiac and pulmonary and things like that. The residents here run all the rapids and codes in the hospital wards, so it's a great way to get practice doing that, build teamwork, get relationships with the nurses and respiratory therapists. So that's something that is a lot of fun for me, a lot of fun for them.
Hi, I'm Dan Huntersmith. I'm one of the faculty here at the Lagrange Family Medicine Residency. I've been on the faculty for many decades at this point, and my primary interest is in geriatrics. I'm fellowship trained CAQ certified in geriatrics. I'll be working with you in your second year in your geriatrics rotation as we go out to a couple of local nursing homes where I'll work with you to take care of a small panel of patients. My other interests are in evidence-based medicine, and I'll be leading a number of journal clubs and teaching you techniques for analyzing research articles. Overall, I've really enjoyed my years at this residency. I think it's a very special place, and I look forward to working with some of you if you come to join us. Thank you.
Hello, I'm Dr. Sarah K. Welch, and I am one of the faculty here at Lagrange Family Medicine Residency. I am a proud of chief resident for the program. In 2016, I graduated, and obviously I'm a huge fan of the program. I loved it so much that I decided to come back as a faculty member. Consider it my dream job just because this is such a friendly place. Everyone in the residency, especially the residents, are treated with respect. So we really, the people here are just fabulous to work with. Now I want to tell you about a couple of my favorite portions of the program, which are our behavioral health and our OMT. So the behavioral health, we have it integrated into the clinic. The residents work with a psychologist, Dr. Cahill, very closely. And typically what happens is a resident will see a patient in clinic and they will decide that maybe they would benefit from a behavioral health session. So instead of just referring them out or referring them to someone else or someone in the clinic, the resident takes the initiative to book anywhere in any of his available slots, primarily on Tuesdays. If they want another date, though, he'll work with them. And then they do the session with him. They typically do about 2 to 3 sessions with the psychologist, and it's a joint session. The resident's initiative in the sessions increases as they gain expertise. So an intern is mostly sitting in, whereas a third year is conducting more of the visit, and a lot of the third years are to the point where they kind of consult. So they will see their patients themselves and then maybe go find Dr. Cahill and ask them for opinions and guidance. But obviously they do still often sit in on sessions with him, joint sessions, and they don't need approval. They can just have whoever they want to see them. I have completed a behavioral health teaching fellowship. So, and I absolutely love doing behavioral health. I have many patients that I treat them for those types of conditions. I enjoy doing it with the residents. We talk about the psychopharmacology a lot. All the faculty do some, of course, though, and we all enjoy it. A particular interest of mine. And then I think that's it for the behavioral health. And then the other section that I really enjoy is osteopathic manipulation. We do have osteopathically recognized with the ACGME. All residents, regardless of MD or DO, start out in osteopathic recognized slots. They can choose to opt out after their first year. We have a small curriculum that's done at the beginning of residency to get a review for the DOs and intro to the MDs. And then we have a lecture series that runs through the year. There are 3 lectures a month. The first one is sports med. The second one is functional medicine, things like exams and using examine the shoulder. How do you examine the shoulder? What are conditions affected with the shoulder? How do you integrate that? And then the final one is OMT, where we review OMT exam and techniques. And then we also have the OMT clinic on Tuesday afternoons, once a month. And there we do group treatment where the residents see their patients, come up with a presentation or discuss their patient to the group, and then we discuss together and treat the patient. The other option is that residents are able to book their osteopathic treatments anywhere in their schedule that they'd like. They're always welcome to bring us into the room, or we will go into the room with them to treat the patient. As they feel more confident, they can treat solo. We encourage residents to share, everybody comes from a different school, so it's a lot of fun for everyone to share their different techniques, and we really enjoy it. I look forward to meeting you all during the course of the application season, and please let us know if you have any questions. Bye.